The worm only has 300 neurons. This is just like, it's like a needle in a haystack compared to in the human. I think we kind of take for granted when we generate a movement. We don't really appreciate how much computing that our body was actually doing. So when you're doing one step forward, you have like lots of muscles has to be precisely coordinated. So your right arm and left arm has to be in a different position, and right leg and left leg has to be in a different position. Actually, a lot of patients, such as the Parkinson patients or the Huntington patients, the problem is if you look at them, they have to think how they can walk. Where now the study that we're doing is actually figuring out the neurons, how they can actually sense the environment and then can entrain their own activity. We're actually starting to get the direct evidence that this nervous system can actually use specific components to sense the environment and then to adjust how much activity that the motor circuit is giving. One of the things actually for Parkinson patients is because Parkinson patients lose these inputs from the higher brain to initiate all the movement, and as a consequence they lose the muscle tones and then they even lose more of the coordination. So one way that we could think about training those patients is really to reroute some of the inputs into those motor systems because they're perfectly fine, they're functional, so that we can use other means to control them a little bit better, and then you can allow those patients to start to walk again. Thank you for the foundation in the hospital. I really think without this, none of this could have happened. And the open-mindedness, right, is critical for scientists to venture into new areas.